Hi, everyone. Welcome. We'll get started in a few minutes. We're just letting people join. If you could please in the chat, let us know where you're joining us from. We'd love to see where folks are joining us from. Okay, we'll get started in like half a minute. I think we're still a few coming in. Okay. So welcome to our webinar today. This is a webinar on pregnancy and physical disability. And we're really hoping towards the end that it can be a discussion for folks with physical disabilities who are pregnant or who are thinking about pregnancy. My name is Nicole Lamerson. I'm a research associate at the Lurie Institute at Brandeis University. And I am with the National Center for Disability and Pregnancy Research. I am also a person with a disability. I have cerebral palsy and I use a wheelchair. And for visual description, I am a Caucasian woman with dark hair that is pulled back, and I'm wearing a gray sweater. Okay. Real quick, for interpretation and captioning, we are providing both for this webinar. If you need captioning, there is a caption button at the bottom of the screen, and our interpreter is in the interpreter box, which you'll have to click on at the bottom of the screen as well. If you have any problems with that, please let us know in the chat, and our tech support folks should be able to help you. Very quickly, just a funding acknowledgement. We are this work that we do at the National Center for Disability and Pregnancy Research is funded by NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research, which is a federal funder. And the views that we express today in this webinar are our own and are not necessarily a reflection of our funder. Real quick about language. We acknowledge the diversity of gender identity, sexual orientation. Oops, sorry, hold on just a second. We acknowledge the, oh, my slides just got messed up. I'm so sorry. Okay. That is not. We acknowledge the diversity of gender identity, sexual orientation, and gender expression, and we strive to be as inclusive as possible. As such, I tend to use gender neutral language in these presentations, so I'll be saying pregnant people a lot. Unfortunately, when we talk about research, which we won't be talking about a ton of today, but we may be talking about a little bit, our national data sets on pregnancy and disability often do not reflect the experiences of folks who are non-binary or trans and are rather rigid in gender identity. But we do use gender inclusive language whenever we can. And then a note on disability language. I will be using identity first and person first language interchangeably in this presentation. I acknowledge that the language around disability is very much in flux and want to be respectful about how folks refer to their disabilities. So really quickly about us, we examine the knowledge gaps in perinatal health. Perinatal health is the time during pregnancy and then shortly after pregnancy. The perinatal health of people with disabilities, and we also focus on preconception and postpartum time periods. We have an advisory board, which is comprised of people with disabilities who have experienced pregnancy and or parenting, and they guide us through all of our resource research priorities. Our advisory board is an integral part of what we do. And as such, our work is guided by the disability rights ethos, nothing about us without us. And we share our work with healthcare providers, policymakers, and other professionals that work with disabled people. But most importantly, we try to make our findings always available to people with disabilities who are most impacted by our research questions. And we try to provide our materials in multiple formats. After this presentation, I'm going to be sending out an email that's full of resources, and those resources will include our website where you can find any and all of our current research. So today we're going to talk about pregnancy and physical disability. And I'm going to take my researcher hat off today, and I'm going to talk a little bit about my own experience as someone with cerebral palsy who had a baby. And so as not to bury the lead, I think this slide perfectly sums up our progression. I included this first slide on the left because that wheelchair was something that I grew out of very quickly. And you can tell from that picture. And mobility equipment and sort of the way our bodies change when we need complex mobility equipment can be a really tough time during pregnancy. But we made it. I relied very heavily on baby carriers, and now my tiny little baby is a seventh grader, or pardon me, she's 7 years old and she's a second grader, and she's 7 going on 17. I'm going to stop the share and just talk for a bit. I'm someone that I never really knew for certain if I wanted to be a mother. I didn't see a lot of examples of moms with disabilities around me, let alone other moms who used wheelchairs. I never saw that. And if you don't see people who are a reflection of you or like you, it's very hard to figure out whether or not something like motherhood is for you. But when I was in high school at a summer job, I worked with a woman who also had CP, used a power chair, and she had a 12-year-old daughter. And I was like, oh my goodness, okay, yeah, maybe I could do this. And I had 2 siblings who were significantly younger than I was. I was starting college when they were in preschool, and I had had a lot of experience caring for them, and I knew that I could do it. So those were sort of, I wasn't for sure if I was going to have kids, but I finally saw an example of someone who did, and I knew that I probably would find a way to be able to take care of them. Got married to a wonderful guy who absolutely wanted children. He only wanted 1 or 2, but he absolutely wanted children. And by that point in time, I was on the bus. Sometimes disabled folks report quite often a lot of barriers to gynecologic care and obstetric care. Looking back, I always used to say, oh, everything was fine. My doctors were always so supportive. And that's the truth. But now when I look at it as a researcher with 15, 20 years experience under my belt, my doctors were supportive of me because I went out of my way to advocate for myself and show them how uber capable I was. And so all that responsibility fell on me. And I'm certain as I'm explaining this, some of you in the audience are nodding your heads. So I advocated hard, and I ended up having doctors throughout the course of my healthcare journey as a young person and into adulthood that were very supportive, including gynecologists that I'd seen over the years who were like, oh yeah, go have a baby. You're going to be great. And that's how it was until I went to my gynecologist and said, no, really, we're going to try to get pregnant. Like, it's time. I threw away my birth control pills, just FYI. And her face just went slack. And she was like, really? Okay. And she wasn't as supportive as I had expected her to be. And I was very disappointed by that. I felt betrayed. I felt very betrayed. And it turned out that my road to getting pregnant was so much harder than I had ever anticipated. It took us 6 years to get pregnant and assistive reproductive technology. I could do an entire webinar on being disabled and accessing fertility treatment. And at some point, I'd love to do that, but we're going to skip over that today. I eventually got pregnant, and it took a long time. But that meant I had a really, really, really long time to research and try to figure out how I was going to do things. And, one of the things I was always so worried about, especially after having a bad experience with that gynecologist when I was younger, was, am I going to find an OB who is going to go to bat for me, who's going to believe in me, who's going to recognize that I can do this, who isn't going to call child welfare right away before I even have this baby. And I found that person, and I found her only because I had a fertility doctor who believed in me, who I fought to make him believe, but he believed in me, and he helped facilitate that relationship and that warm handoff to an obstetrician who absolutely believed in me. But there came a point in in my preconception journey, even before I was pregnant, where I needed to see a lot of specialists. And I saw a hematologist. I can't even remember why, but this hematologist took one look at me and just said, "Oh my God, if you really think you're going to have kids, well, you better have a lot of help because you're going to need it." And it didn't help that earlier in that visit, when they were weighing me, the scale was not accessible and I fell in the office. So it was a terrible visit that just took the wind out of my sails. I was doing the most responsible preconception type thing you can do. And I was being told, how much help I was going to need. Well, all new parents need help. All pregnant people need help. And I'd like to say that I fought back with her and did some education that day, but I didn't. I was scared. And I was afraid she was going to be a gatekeeper. So I kept my mouth shut. I nodded. I said, "Yes, I have lots of help. I'm going to be okay." And went on my merry way. So when I finally got pregnant, I have cerebral palsy is one of those disabilities that we don't think negatively impacts pregnancy directly. There was really no reason to think that I would have problems with the pregnancy itself, but perhaps my mobility, which was a little rough anyway, might get worse. I'm someone who uses a wheelchair for at the time for long distances and crutches for short distances, and my mobility needs changed a lot. I went from being a crutch walker and an independent walker in the house to using my wheelchair in the house, except my wheelchair didn't always fit. And that became a real barrier. And I see this a lot. And as we, after this webinar, I'm going to send out some resources. But one thing I sought out was just a spare wheelchair that was a little bit wider than the one I had, because my hips had changed. And I actually found a spare wheelchair through my state's durable medical equipment reuse program. Most states have one of these, and I'm going to put some links in an email, but they were able to give me a chair. It wasn't a perfect fit, but at least I was comfortable. And I also had a backup. I had a friend who had a chair that she was going to let me use, but I didn't want to take her spare. But my mobility was a huge thing. And then, well, you're pregnant, and I'm going to share my screen really quickly one more time. And hopefully you can see this. Finding accessible baby equipment. And what am I going to do? How am I going to take care of this kid? That was tough. And when I went to the internet, I found two options. I found the Pedialift crib, which retails for $25,000. They don't put their price on the website. And we all know when we see something and there's no price attached to it, we know it's because the price is exorbitant. And then the other crib I found was the Gertie crib, and the sides opened up and it looked lovely. But that was $4,500. I do know some people who have this crib and they like it. But neither of those felt like options for me. So these were sort of what was on paper, ADA accessible by the law, very carefully crafted. And I had to go the different route, which was accessible baby care. And I found this fantastic crib that zips down on the side. I'll show it to you in a minute. A picture of my kiddo in there. This is called the Lotus Travel Crib. And I found this like wonderful blanket where this is a blanket that allows you to pick up your child with one hand. Anyone who sews could probably make this sort of blanket. And then this is a baby carrier, but it's specifically to hold your baby on your lap. And it's called the Lap Baby. And they market it to people who work from home. I use this as my principal baby carrier because it held my daughter very close to me, and I bought it before I even had her, and it turned out to work really, really well. But searching for accessible baby equipment was like, that was almost my full-time job during my pregnancy. And here's a picture of my daughter. My husband built this coffee table height platform and bolted this crib onto it within an inch of its life. And I used this for diaper changes, and it was wonderful. It worked out fantastically. But during that time when I should have been able to be really, really excited about my pregnancy and going to Babies R Us, which doesn't even exist anymore, and picking out really fun, cute things, I was doing all this strategizing about, oh my goodness, how am I going to do this? And it was a very stressful time. Ultimately, the one thing I learned through my pregnancy was that every single coping mechanism I had acquired as a disabled person in my life really, really benefited me, both during the pregnancy and once I had the baby. And I believe that a lot of those coping mechanisms and a lot of the problem solving and strategizing we naturally do as people with physical disabilities has made me a better mom. So if there's one thing I want to stress in this presentation to any of you who are people with disabilities, physical disabilities, or any other disability, who are contemplating pregnancy, is that your disability can be a strength in this process. And that in some ways, you've been training a long time for this, because having kids requires patience. Being pregnant involves not feeling so good, and maybe your time isn't always your own. Some of us with physical disabilities already know that and have a lot of experience with it. I, for one, was so glad I was already a wheelchair user once I was pregnant, because I don't know how non-disabled pregnant people walk when they get very far along in their pregnancies. Everyone's always complaining about sore feet and bad backs. And I never had that problem because I was using my wheelchair. It was everything prepared me. And I am not Pollyanna about this. I had my baby 7 weeks early. I had complications due to outside things not directly related to my CP, as far as we know. But, it was okay. I had, my worst fear came true with that pregnancy. I had done everything right. I was so excited. I was so proud of my body for actually doing something right for once. But I still had that baby early. And that was tough. But we too made it through that. And again, it was because of so many of the coping mechanisms and the problem solving skills, and just the, I don't know, mental flexibility that you pick up when you're living in a world that is not built with you in mind. So I don't want to dwell too much on the fact that I had my baby early. I just want to say we made it. Everything was great. And that having my child was easily the very, very best thing I've ever done. And having a disability can really set you up to be a wonderful parent. It doesn't have to be a deficit. And with that, I'm going to turn it over to Laura. Very quickly, I want to give Laura a quick introduction. She's the director of contract operations at Blue Cross Blue Shield of Massachusetts, and she's the president of the Empowering Abilities Employee Resource Group at Blue Cross. She was appointed by former Governor Charlie Baker to the advisory board of the Massachusetts Commission Against Discrimination, and she is also a member of our current governor's Disability Rights Advisory Committee. She's an active member of Little People of America. She's a little person with 2 daughters, and her husband Theron is also a little person. And I'm going to turn it over to Laura.
Oh, thank you, Nicole. Just doing a little sound check. Can you hear me okay?
You're good.
All right, terrific. Well, I just want to say thank you for sharing your journey. I mean, every pregnancy feels a little different, and your story was full of helpful information, but also just about your empowerment and how you navigated those 48 weeks. Even though you delivered early, you still had that journey, right? Of the complete pregnancy beginning to end, and the road you took for managing through the assisted reproductive technology. I mean, you had a lot packed into that pregnancy, right? And look at you, you're doing amazing. And I appreciate like another mother sharing kind of the journey. And I think it's a story we need to hear more about. And I'm glad that you opened it up. And I was reading the chat and I've been like, I can't like the chat in Zoom. You know how like in Teams you can go like it and put a heart or whatever. So for all those who chimed in on the chat, I'm like, there's a little heart emoji there, but it's not, you can't see it. But anyways, but thank you, Nicole. I think it was fantastic to hear your journey, and I'm looking forward to having more of a dialogue. I'll just give a little bit of an overview of myself. Like Nicole, let me start with the visual description. I am a Caucasian woman. I am about 4 feet tall, and I don't use any assisted mobility devices, and I'm wearing glasses. I'm wearing them now. And I have brown hair, kind of a modified crop bob, however the hair wants to fall on any particular day. I'm wearing a black top with a kind of goldish yellow blazer over. So, but great to be here. My role at Blue Cross is important. However, my role as a mom and a parent is what takes priority. And as Nicole has said, having the journey of being able to take myself, my emotions, my body, my family through 2 pregnancies of 80 weeks of, my life dedicated to, growing and, having a baby has been quite a miracle for me. So myself, my pregnancy journey, my husband and I were married. We started having children right away. I had my first when I was 40 years old. Excuse me, my first at 38 and my second at 40. So I had them both pretty close together because of our age. We really wanted to get our family started right away. I didn't have any challenges with getting pregnant. I think my husband and I really wanted to get things moving because of our age. And I think that was a consideration for sure. I did interview OBs prior to us, officially declaring pregnancy. We were trying, but wanted to make sure that I had an established relationship with the practice that would be willing to take on, a mom or a woman who's looking to be pregnant and also having some physical challenges of being a little person. And I ended up going with a high risk pregnancy practice partly because of my age, that kind of what trumped me into that category, but also, because of my disability. And that kind of came secondary. I think, when you have age-related pregnancies that are, in the high 30s and, 40s, you definitely have other risks, right? So there wasn't anything I was anticipating really because of my age, but I didn't know until I kind of took the journey. And I thankfully didn't have any complications that would come with an age-related pregnancy, in your late 30s and 40s. So um, I will say my husband and I did take the journey of genetic testing at the beginning because my husband and I both have different types of dwarfism. It was important for us to understand what we were going to be dealing with. Not that we had any specific decisions that we would have made because of that, but I think we needed to understand what the risks were. So, and not even risks, but how the pregnancy would evolve. So we understood the genetics. 25% chance the child would have my type of dwarfism, 25% chance my husband's type of dwarfism, 25% chance that the fetus would be unaffected and not have dwarfism, or 25% chance of being double dominant, being present with both of our dwarfism genes. And that can present such complications where the fetus may not survive. Not at all, but so these are the things that we needed to consider. And I think possibly too, with our age, I think as you get experience with different things and you always want to know, the facts, the decisions that you might need to make. So for us, our first, it was kind of done in stages. And I just want to share this because not everyone will go through genetic testing. But for us, it was important for me to find a genetic lab that would be able to identify both genes in the fetus. I didn't want our, amniocentesis and our CVS samples to be going to different lab, different criteria, different quality controls in place. And we did, with the help of our genetic counselor, found a lab that would be identify both genes from my husband and I and be able to perform the assessment. It took about maybe 10 weeks. It kind of came in stages. First came the gender, then came any identification of other types of genetic conditions, and then the dwarfism, whether it was present or not. So with our first, we found out she was going to be a female and that she had my type of dwarfism. So that would help us understand any complications that I might have upon delivery. So that set the stage for my team to really establish a care plan for me, and which was both mostly it, the physical part of it and the needs really kind of came from me, right? Like I would say, I need this, I need a shorter gown, I need to be able to get up on a table for an exam, I need to be able to ensure that I can get access to the ultrasound equipment, things that kind of come up in the moment until you realize that you might need a specific test. But for all intents and purposes, I mean, with my first pregnancy, I didn't have any complications other than that I got really big. So with both of my pregnancies, I don't have a picture. I would have sent one to Nicole, but I was 4 feet around and I'm only 4 feet tall. So my pregnancies really presented themselves. So I was pretty much as wide as I was tall. I delivered at 39 weeks. I will tell you each time with my OB with both pregnancies, I was like, please, can I go early? Because this was really, it wasn't that it was difficult from a perspective of a medical condition. It was physically difficult because I'm carrying all this weight, So I gained about 30 pounds on top of my weight. So I went into the pregnancy with, my average weight. I wasn't overweight, but this definitely did take a toll on my body. I will say at the end of the day, I worked up until 39 weeks. I don't know how I did it. Like Nicole said, you look back and say, how did I get through that? And you just find the way to do it with support of my husband and just really listening to my body and taking it slower than I usually would. But I will say I delivered at 39 weeks with my first, and it was a C-section. As Nicole may have alluded, or she might have told me when we were preparing for this, but there were a lot of people in the delivery room to prepare for any situations that might encounter with the baby. And she was whisked off, with all, testing just to make sure she was able to breathe. And there wasn't anything that was going to present for her not being able to, be in a bassinet and et cetera. But long story short, very typical C-section that I had. I recovered along, like other moms that aren't little people in the sense of, I, had, 12 weeks of some restrictions, lifting, because of the C-section, but, we were very well prepared for that. I think, the hospital stay, yeah, it was challenging only because you're just not feeling the greatest after a C-section. You've got a lot of things that you're trying to maneuver through, getting through the anesthesia, getting through the incision, and just physically trying to get yourself, acclimated, and then breastfeeding, getting acclimated with that. I have shorter arms, really trying to understand how I was going to be able to maneuver the baby for breastfeeding. And I was very much a strong advocate for myself, to breastfeed. And I did successfully for 18 months. And that was a lot of problem solving as well. And I'll touch on that in a second. But I will say that, the modifications during the hospital stay were, we need to cut the gown. I don't want to fall the thing, that you guys know what they look like. They're the same hospital, they're the same pattern, the same blue, with the tie in the back. And I said, if you don't have scissors, I have them. But anyways, self-advocacy may seem a little rude, but it wasn't. It was just really more for my safety. But at any rate, I didn't have a bassinet in the hospital that I could reach, so I could get my daughter out. So I needed assistance. That hits an age. So the hospital now, with advocacy and myself and some other moms, have really made accessible bassinets, right? Because the bassinet is usually in your room pretty quickly right after you deliver. So, but at any rate, we for that. And I was patient in that way because I couldn't change the world. I just need to make sure my baby was fed. I was getting the needs that I, required. But sometimes like the advocacy can be in the moment, right? Until you get outside the situation, you can really have a constructive consideration of what to think about. Because your care comes first. Like I agree, you gotta advocate, but sometimes you gotta just worry about yourself and how you're going to be able to get the direct care you need. So, and when I mean advocacy, more like, the public relations advocacy, make sure every person has this. That kind of had to come secondary for me during my delivery because I need to make sure that I was safe, that I was being cared for, and that I was able to get what I needed in my baby as well. So that was first delivery, right? So let me just say, let's take a pause and we'll talk about the breastfeeding for a minute. So shorter arms, present issues for being able to hold my daughter. My daughter came in at 7.5 pounds, 18 inches long. So she was pretty much, average size baby in the weight and the height. But she, did not, she took her a longer time to grow. So she stayed in newborn diapers and newborn clothes for a long time. So I kind of had that period of time where I was able to get through all my diapers, when sometimes, when you have an overflow of newborn diapers, you're out of them in like 3 weeks, but I didn't have that. I mean, I was able to have her stay in those for a good couple months. But anyways, I don't want to divert on that, but let me just tell you about the breastfeeding. So I did get some counseling in the hospital, did get a lot of training on the latching, but you just don't feel well sometimes because you're really recovering from the C-section and your body adjusting and the hormones coming in, your milk coming in. So when I got home, I did get some telephone counseling from the lactation consultant at the hospital because I was concerned about the latching, right? And my daughter actually had a tongue tie at the time, so that presented complications for her. But I ended up finding a lactation consultant practice in my area and I had them come to my house. I ended up just, paying for it out of pocket. I was like, well, just gonna do this because I need to make sure she was fed. So she came to my house and she had experience with working with people who had different mobility challenges, right? With lactating and making sure, breastfeeding was successful. I ended up going with the hybrid approach. And this isn't for everybody, because I, want to be respectful of people's opinions in this way. But what worked for me was that I breastfed, I pumped, I breastfed, I pumped, and I was going back to work in 16 weeks, right? So I started on my milk supply pretty quickly. My whole freezer for the first 6 months was all breast milk. So I wanted to get to a place as I was adjusting, getting back to work, that I had enough breast milk on hand, right? So that I could bring it to daycare and that we would have it. So I ended up, going through that supply, I wouldn't say quickly, but I had planned enough. So I ended up having to do breast pumping on demand at night. So in my kitchen, I had a little area where I had a stationary breast pump. And I will say I didn't have people come over for a long time because I was like, I was on like rapid breast pumping. I would feed, I'd pump, I'd feed, I'd pump. Yeah, it's exhausting. But in between that, my daughter did have a lot of doctor's appointments. She did present as profoundly deaf at the time. So we had a lot of testing. So I was very much focused on caregiving, right? The breastfeeding, getting her to appointments. And by that time, I was back to work. So I will say that I do think if you can find a lactation consultant in your area that can come to your home and help you with positioning, help you with the football hold or the lap chair that Nicole showed, that I wish I had had that when I was, pregnant, because my daughter's now 17. So, but I think it would have been fantastic if I had that during pregnancy to be able to have that extra support. So that's pregnancy number one. So let me just switch now the dial to pregnancy number two. Again, we got pregnant pretty quick, 2 years after. We didn't want to waste any time. So by the time I delivered you, I was 40. And my daughter we went through the same genetic testing. So this was a different journey because her genetic testing results came back that she was unaffected and she was average size. So interesting enough, same genetic lab that we used. And I want to point out that what was interesting here is that when the genetic counselor had shared the results, because again, like I said, they came in stages, it was gender, it was specific genetic issues, and then the dwarfism, affected or unaffected, came through. I will tell you that the lab was really concerned about the results of my daughter being average size because they had said, "Oh, are the parents going to be okay with this? Are you sure do they want a child like them?" And so for us, it was really interesting to kind of hear that. And let me dial back. I did hear that as well on when we found our daughter was impacted with dwarfism too. So it was really funny to hear that there was an opinion, like thoughts of like, oh, are the parents going to be okay with the decision? And I kind of was taken back by that, to be honest with you, both times. I said, yeah, we're here for the parenting journey, right? We're here for however our child shows up in the world. So I found that interesting when I look back on that. I will say when I started sharing with people during my second pregnancy that my daughter was going to be average size, I got a lot of questions. People were like, oh, you must be thrilled she's not going to have a disability. I was like, what? So I'm saying that unintended comments can sometimes really derail you and kind of emotionally impact you. I mean, it made me pause for a long time because I didn't share that she was going to be average size, because that really hit me hard. And I will tell you that um, I've moved on from it, but I want to point out that, when you are a person who has a disability, you may get reactions like that. And how you choose to react to it in the moment, or how you choose to not, or how you choose to follow up with the person afterwards, I think that's your choice. I do want to say that, sometimes people just open their mouth and they say whatever, right? And that was one of those moments. But I don't want to derail that because it's still one of the most amazing journeys that you'll take as a mom, being pregnant. Um, so that delivery, again, 4 feet around, I was huge. I showed pregnancy much, much earlier. I think 6 weeks. I was like, I couldn't hide it. But anyways, not that I was announcing, but she announced herself in that way. But again, she was bigger. She was 10 pounds, 22 inches, big baby. And I would come home at the end of the day from, working again up to 39 weeks. And I actually had a walker when I got home because I was so heavy in the front that I was like hunched over. So I definitely, my husband had to push me out of bed every morning and during that pregnancy because I was so big. But again, went through the breastfeeding journey, lactation consultants, etc. So much of that I replicated. But the difference for me in this pregnancy was she didn't stay in newborn diapers for 3 4 months. She was out of them in like 2 weeks. So she grew faster. So I now had like, a rapid fire growth, right? That I was used to the slower growth, so slower patterns there. And so I had to jump on board pretty quick. So I will say for both pregnancies, that car seat, for all of us, no matter whether you are able to carry it or not. It was heavy, I ended up kind of doing some modifications in my way in my home where I had I would carry the car seat like step by step downstairs. I wasn't like carrying it on my arm and like gonna just topple over. So I really made sure I took my time. I'd get the baby bag in the car first, things just to make it a little bit easier. So you're so focused on making sure the baby was safe in the car seat. Um, and I will say I had a carriage in the house that I bought so I could wheel them around when they were infants. So like if I was going to one room and I didn't want to carry, I had the carriage. And it was a traditional, like you guys know the Bugaboo. They have different versions of it now, but it was like the bassinet one. And that was fantastic. The other things I did was at the time, it was the early adoption of like the Peapod, the grocery delivery. I did that because I just, that was like one more thing on my list. I did arrange both pregnancy for meals to be cooked. So I worked with someone who was, she wasn't really like a chef, but to me she was. But so I pre-planned meals with her and I paid her by, meal. So I did like 4 meals with her a week. She delivered them on Monday. And then I had meals because I will tell you, 2 kids, 5 o'clock, feeding them and doing the breastfeeding, pumping, and all that. It was chaos. But, looking back, it was fun chaos. But, taking that off the table, I do think, consider any ways that you can, I don't want to say make shortcuts, but lean into your community. Those first few weeks of my second, when she was delivered, I had 8 people that I kind of just said, hey, can you come over like once every couple of weeks from 5 to 7 to help my husband with the bath and just, whatever like that. And they loved it. So they knew they're like, oh, I'm on point. I'm happy to help her, for 2 hours on a Tuesday. So I set up a schedule so that people wouldn't feel like I was tapping into the same person. And who doesn't love to hold a baby? I'm telling you, every baby cries at 5 p.m. no matter what time zone they're in, because they're hungry, the time, the daylight changing, whatever. I felt like for me, it was always a witching hour. But so I will say, I now have a 17-year-old and a 15-year-old, right? And I'm standing here today that I made it through, like Nicole said. But it takes leaning into your village. It takes leaning in and asking for help when you need it and how it works for you. Now more than ever, there are so many resources and videos, TikTok, even though I'm not on TikTok, but of people just kind of sharing their best practices, whether they're living with the disability or they're not, right? There's some nugget that you can take, say, I could change that. So I do say lean into your village, check in with people. Your emotional wellness and well-being is of most importance during the time of a pregnancy and post-delivery. Lean into the resources you have maybe from your health plan. I'm not trying to give a plug for Blue Cross, but I'm just saying there, pregnancy resources there. So but anyway, so I think I'm getting the hook. Am I getting the hook, Nicole?
I want to leave about 15 minutes so we can
Yeah.
have Q&A, but thank you. There were so many things in your story, especially around the breastfeeding piece that I could relate to. I think we have a comment that I'd like to address around that.
Let's go for it.
I'm going to go to the Q&A first, and the first one I want to address is from Marissa. Can you talk a bit about intersectionality and the role that plays for pregnant disabled folks and the care they receive? The first thing I want to acknowledge is that on this webinar, we are 2 white women. And we know through our work at the National Center for Disability and Pregnancy Research that the experiences of pregnant people of color are not platformed the way they should be. And all of the maternal health and severe maternal morbidity and mortality that is happening within the Black and Brown community, we are specifically looking at this. And to that end, I have a study that I'd like to share with you. We are recruiting for research participants, but there were times in my pregnancy where I knew the only reason certain doctors who maybe were not treating me as respectfully as they should have I knew that that situation would have been so much worse if I were a woman of color. And when I was in the NICU with my daughter, um, I I saw racism in the NICU, and it is a huge problem. I'm on a maternal health task force in Massachusetts, which is specifically looking at the experiences of Black and Brown women in our state, because our maternal morbidity and mortality rates have actually risen in the past decade. The table is big, and I we value
Mhm.
your opinions, especially the opinions of people of color. Your stories need to be platformed and told, and we're all better for it. So I want to acknowledge that. Certainly not a blind spot on my part that there are two white women on this webinar.
Mhm.
Um, and there was another comment here about about a breastfeeding coach. And Amelia says, I had asked the hospital for a breastfeeding coach and they never responded. That small thing was very important to me. It gave me terrible postpartum depression. And I want to acknowledge that that time after birth can be so fraught and so emotional, and
Mhm.
and the way providers interact with us and talk to us matters
Mhm.
so much, because you don't forget what happens in the postpartum period. I had a postpartum nurse who treated me terribly, and I had to run that up the flagpole and call patient relations from my hospital bed. And I had very severe PPD, which manifested as anxiety from that. So I want to recognize you, Amelia, and tell you that I'm sorry. And the little things these physicians do, these healthcare providers do, really mean a lot. And I actually told my own provider that. I said, you know, everything feels amped up right now, and I'm already
Mhm.
someone who faces discrimination. So let's just pave this road as smoothly as we can.
Mhm.
It's very important. Laura, do you want to add anything to that?
Yeah, I mean, I think on the breast feeding and lactation consultant, I can tell you that that's not an unusual experience, right?
Yeah.
I just took it on my own. I wasn't gonna, you gotta feed your baby. You just do what you can, right? And not that I wasn't, if I had to go to formula the first time, I would have, like if I couldn't have made it work. So I'm just saying that if that's not the road for you as a mom, I get it. So don't take me this as like I'm saying you have to breastfeed. Okay. So let me just tell you what, looking back, I think the way that I handled it was I just searched it up, right? And I even asked the lactation department at the hospital and said, who in the community do you guys use? Can you give me some names? And I just started calling, right? I was not giving up. But now there, I will say there's a resource here. That's a national resource. It's called the Independent. No, the yeah, Independent. I'll give it to Nicole to send it out. But it's the IBCLC, the Independent Breast Consulting Lactation Consultants. I'm not saying the right acronym, but they have a statewide directory that you can go in, put your state, and they'll help you find a provider. Right? There are laws that do require health plans. Again, given the health plan that we have to cover lactation counseling, whether they do it in your home, telehealth, remotely, however, right? So lean into that site. They can help you find someone. And sometimes like the remote can be just as helpful, right? The telehealth, they can have a camera and they can see how you're doing things and give you, even if they're not physically with you. So I would say lean into those resources in that way. Is that
Yeah.
helpful, Nicole? Anything else you
Yes.
think I should
Yes.
add there?
No, I think that's definitely helpful. Um, yeah, I think I pumped for 12 months because my
Mhm.
baby wouldn't latch. Breastfeeding is no joke. And
Mhm.
it for some of us, it can be the ultimate at adaptive parenting mechanism, because you take that baby, you put him on the breast, you don't have to get up. But for others of us, it's almost out of reach. And
Mhm.
and however you nourish your baby is best. My adaptation with breastfeeding was pumping, because there was no breast directly feeding. I kept a cooler in my bedroom, and after I'd pump in the middle of the night, I just toss it in the cooler so I wouldn't even have to get out of bed. I want to address another question here. Curious if there are any suggestions of accessible tools for new parents that use a cane. Um, so one thing I didn't mention in my talk is I use all the mobility devices, soup to nuts. Sometimes I walk independently in the house, sometimes with a cane, sometimes with a rolling walker, sometimes with crutches, sometimes manual wheelchair, sometimes power wheelchair. And when I was pregnant and when I was a very new mom, I considered my mobility equipment to also be baby care equipment. And one thing I suggest is to look at your mobility equipment options and decide that maybe is the cane the best way for me to get around while I'm taking care of the baby. Sometimes for folks who are unsteady walkers, it makes sense to have a chair in the house. And again, getting a wheelchair takes a lot of time and perseverance, and it's not something you can magically acquire at the drop of a hat when you have a brand new baby that needs care now. But again, looking at friend networks, if you have friends, or uh, a DME reuse program in your state, I really do suggest kind of flexibility around mobility equipment. I found, rather than using my crutches in the house, my rolling walker was
Mm-hmm.
really great because I could load up that basket with baby stuff, because it's hard to carry stuff when you use
Yeah.
canes or crutches. And then when my kid was a toddler, her favorite place to sit was on my rolling walker. So when we were out and about and I was walking, that was my de facto stroller. Um,
I love that.
yeah. Um, Another question, how can parents, especially with disabilities, advocate or ensure that a law is passed to offer insurance covered midwives? I think I'm involved at the state level for our maternal health initiatives, and I encourage any of you to see what your state is doing and make a place at the table for yourself. You might have to really have sharp elbows, but the only way that these things change is when disabled people are at the table. And I'll give you a direct instance where a lot of disabled people spoke up, and something really great is now happening in Massachusetts. It wasn't just disabled people, but lots of other people who wanted this care. On our state Medicaid program, Mass Health, they are rolling out a doula program where doulas will now be covered for any member on Mass Health, Massachusetts Medicaid. And that it's just really fantastic. And doulas can be such a wonderful person to add to the team when you're a disabled person who is laboring and delivering. So I do encourage you to get involved at your state level. And if you ever need help finding resources and at your state level, I'm going to put up my email address. I do a lot of technical assistance and kind of fact finding around these things. I'm happy to help. Laura, I might have you take this one. We have 5 minutes left.
Mm-hmm.
Do you have any thoughts or advice for pregnancy with a rare disability that many providers do not understand, such as connective tissue disorders that can impact pregnancy?
My thought on that is, depending on where you are in the country, if you have access to a health system that has an OB department that handles high-risk pregnancies, and I know that may not be the case for everyone, but I live in Boston. I did have access to a medical facility that had a high-risk pregnancy practice. And so in those cases, they're skilled at truly trying to understand the nuances or the health conditions of the mom. that might impact, any type of genetic testing that may be done if you decide to do that. I think going with a high risk pregnancy, if it's accessible in your area and available, they also have the genetic counselors available too that can help advocate to understand this is what this condition does. This is how it presents in a patient, and this is how it presents in this mom, right? And these are the things you need to consider because they also have the facts as well. So I do think that pairing up of a facility that does it usually is could be a teaching hospital or a tertiary care hospital that will have these types of departments where the high risk OB practice, right, that had or the clinic or department is paired up with the genetic counselors. So I do think that's a good matchup
It's great.
that can really help advocate in situations like you're describing.
Thank you, Laura. That's really helpful. I, along those same lines, I chose to deliver at a very large teaching hospital in Boston because I just wanted the off chance that anybody there who took care of me had maybe seen someone like me before. And that
Mhm.
turned out to be actually the case. Laura talked a little bit. Laura talked about high risk versus non-high risk. I technically was not high risk. I was 37. I was really on the age line there, but I ended up working with an OB who was not a high risk OB, but she worked alongside within a
Mhm.
practice of high risk OBs. And it was like step down. It was a
Right.
and she just had that mindset that maybe we manage you differently. And that worked really well for me.
Mhm.
One thing she did with me was when my mobility issues were really going south and my blood pressure was starting to skyrocket, she put me in the hospital on antenatal a little bit earlier than maybe she would have put a non-disabled um, patient because she recognized I was driving a lot to see her. And, she just, that she didn't have to be an expert in my CP. She just needed to be an expert in the ways that, first of all, an expert in listening to me
Mhm.
and an expert in listening to you. That's the most important expertise. But recognizing that my experience was different and may need to be handled just a little bit differently. And sometimes handling things just a little bit differently requires more insurance approval and justification. And she was willing to do that for me. And that was so important. And it was integral to me and my baby having a really good outcome despite having some challenges. We're at 2 minutes. So I very quickly just want to share my screen. Um, And first of all, this is Laura's lovely family. I showed mine. Want you to see Laura's family. And then our research. I'm going to send out recruitment information for both of these studies. We want to hear your birth story. If you are a Black or brown birthing person who has had a child within the past 10 years, we would love to hear your story and document your story for our research to learn more about your experiences. I will send out a link to this. Your time will be compensated with a $50 Amazon gift card. And then this other study we're doing, so that study is for people who have already had a child. And it's okay if you're pregnant with your second, but we are looking for people who have already had a child for that one. This second study is for any person with any disability who is currently pregnant with their first child between 12 and 36 weeks. We're working with pregnant disabled people to develop an accessible birth plan to talk about what you feel might be helpful in your birth and your delivery and your laboring, what you want your doctor to know, and anything you feel is pertinent around your pregnancy due to your disability. And the as we work through this and have several conversations with our participants, we will produce a birth plan together. This study is being done with a colleague through University of Cincinnati, and I'm also on this study. And if you're interested in this, you might be talking to me. We do compensate. This is also, I believe, this one is $50 cash per session, and it's two to three sessions across your pregnancy. Again, I will send out a link. And here's how you can find us. We are on that website, formerly known as Twitter, Facebook, and my email address below. And I want to thank everyone for joining us today, and thank you for your very thoughtful questions. I apologize if I didn't get to them all. And thank you, Laura, for once again helping us in such a great way by sharing your story about your labor and delivery and pregnancy. Take care, everyone. Thank you so much.
Take care. All right. Thanks, Nicole.
Bye.
Great to work with you. Be well, everybody.